Well, I was looking through our website, and I think we've tried to do a pretty decent job of setting up the steps to prepare yourself for therapy, but there's nothing like explaining the whys and the steps myself. So I'm going to kind of explain why we put the steps in there that we put in the process. I think once you realize if you're suspecting that your child is having some issues, usually more often than not, parents wait way too long for this process. I often hear parents just when I'm in parent meetings, again in tears, why didn't I do this a year ago when I thought about it? Why didn't I do it 2 years ago? Generally speaking, our kids don't grow out of these things. So you're going to find it's only going to get worse over time. So the younger we address the situation, the quicker we can resolve it, actually. So it's going to end up being easier on you and a lot more cost effective, which is important to think about also. So if you're suspecting that, I would run with your expectation and at least come in and do a tour and talk to us and maybe give us some information about your child so that we can help you in that process. Because I can tell you 9 times out of 10, when a parent suspects it, the kid ends up in treatment. So your gut level feelings are probably accurate. So think about that first of all. But then when you go to you're welcome to go to our website and do a tour, and that way you can come back and kind of see what's going on in the clinic. I think it's important to get a visual. It gives you a feeling of comfort. It allows you to see whether you think this would be a fit for your family and your child. And that can be just scheduled on our website at any time. You can do that any one of our offices. Usually at that point, if you want to move forward with treatment after viewing the clinic, we also ask you to send a benefits check-in. That way, when you can do that before the tour, which a lot of families do, which I think is a great time to do it, because that way we can give you that benefits information at the tour. We really want you to know exactly what this is going to cost you. So we'll call your insurance and we'll verify all that for you. So like I said, you can do that before the tour. If you don't do it before the tour, we'll collect the information at the tour and we'll call you in a day or so to give you that information so you know exactly what it's going to cost. After that, if you decide to move forward with the evaluation, we ask that you do paperwork that's on our website. It's under the Forms tab, and you select which office you're in, and that paperwork automatically goes to the office. The reason we need that paperwork is that allows us to understand what issues are going on with your child. It gives us medical history. It gives us a lot of information about your child so that when we go to select our assessment forms, we're able to do a better job of selecting them quickly and also kind of formulate what we want to do at that evaluation. Once those forms come in, we have 2 sets of forms. There's a general intake, and that's basic general information. That's also going to have your benefits check information on it. Then we have 2 other forms. We have an occupational and speech therapy specific form, and then an occupational and physical therapy specific form, and then we have a speech therapy specific form. So if you're going to pursue all 3, you'll have to complete both of those. If you're going to only pursue OT or PT, you just complete those. If you're going to be doing speech and OT, you still have to do both sets of forms. And that's really key to the therapist. They're looking at developmental milestones, they're looking at behaviors, they're looking at daily schedule, just a lot of different things. So once those forms are in, we can go ahead and, at least if we get the general form in, we can go ahead and schedule the evaluation. And then we will need the therapy specific forms at least 3 days prior to the evaluation so that we have enough time to really evaluate those forms and look at the best assessment tools for your kiddos. So that's generally the way the process looks. Then once your testing window per discipline runs about 1.5 hours to 2 hours. Sometimes we do it all in one day, sometimes we spread it out. It's really based on your child, and we're going to get a good idea what they tolerate based on the forms and what you complete about your child. Once we complete all the testing, we will have a parent meeting to go over all those reports. And then at that point, if treatment is recommended, we will go ahead and schedule treatment at that time. So that's basically the process. We will go ahead and get the prescription from your physician because some of our disciplines require a prescription prior to treatment starting. We can evaluate without a prescription, but we have to have a prescription from your doctor to do treatment. And we will go ahead and contact your doctor. And if we have any issues contacting your doctor, we'll go ahead and let you know that, because sometimes it requires an additional phone call from mom or dad. but not all the time. So that's the basic process. From beginning to end, that process is anywhere from 2 to 4 weeks, depending on how quickly we schedule everything. If we do an evaluation 1 week, we do the parent meeting a week later. It takes us about a week to generate the reports. And that parent meeting runs about 30 minutes. We ask, it's great if both parents can be there for the parent meeting. That's not always the case. Sometimes dad can call in from work, but we ask you not to bring your kiddo because that's a time we really want you to focus on what the therapists are saying to you. And that's pretty much the process.